Hello everyone, my name is Aldrika Glover Hill, and we will be discussing the various roles of the nurse educator. At the end of this learning objective, students will be able to define the role of the nurse educator as an advisor, co-learner, mentor, and collaborator. Compare and contrast the different roles of the nurse educator. Identify learning examples related to the different roles of the nurse educator. We all know that nurse educators have multiple roles that involve teaching, advising, learning, mentoring, and collaborations. Nurse educators help guide students through the entire learning process and serve in various roles so that students can be successful. Nurse education began with Florence Nightingale being the mother of nursing. She established the first school of nursing in England in the year 1860. She helped serve soldiers during the Crimean War. From then on, Bellevue Hospital opened in 1873 as the first school in the U.S. to follow the principle of Florence Nightingale. The nurse educator role as an advisor. The advisor is an educator who must have the knowledge and skills to empower students. Advisors help build relationships with students. They have good communication skills and they help students meet their expectations. Advisors assist with selecting courses, determining prerequisites, determining short and long range goals, and they monitor the overall progress of the students. The advisor must be one that considers a student's lifestyle since students most of the time still work full-time jobs. The advisor is there to give support on whatever goals they are achieving and help them make good decisions. As co-learner, nurse educators assist with exploring knowledge so that students and the educators can learn as well. As co-learners, nurse educators make a commitment which involves knowing the material that is being taught, problem solving, connecting with students, and understand the way students analyze knowledge. Nurse educators can demonstrate co-learning by working with students in small groups such as in clinical settings, discussing classroom experience, and even helping give knowledge about the digital age. We all know that the use of digital tools can be difficult to navigate for some adults. So nurse educators can reflect on their experiences and take learning examples for students on how well they navigate through it. Another example of co-learning is a nurse educator staying abroad of the NCLEX exam, which changes every 3 years. This takes studying the different evidence-based practice to help facilitate learning for students so that they can be successful on the NCLEX. As a mentor, nurse educators are responsible for mentoring current and future nurses. They also help mentor other faculty. Mentors help shape the student's career by providing an environment that is caring, connecting, and open to communication. Mentors have experience in subject matter. They provide advice to students about learning, guidance on work life, and personal issues. Mentors support colleagues by providing feedback, guidance, and support with teaching, research, scholarship, tenure, or promotion. Mentors help guide you through your career path and they build long-term trusting relationships. In collegiality involves faculty working in a collaborative mindset to enhance student learning. They are able to communicate, participate in decision making, create partnerships, and teamwork. This helps enhance the nursing profession by revising nursing content with other staff and faculty members, adding or removing of courses, balancing of clinical hours, and strategies that help promote competent and safe nursing. Collegiality also involves working with the state boards of nursing to ensure that graduation from nursing education programs, there are adequate graduates, and making sure that there's a good NCLEX exam passing rate. Nurse educator also work with stakeholders such as lawmakers, hospital boards, and the community on how to provide better outcome for patients, decrease costs of health care, and nursing job retention. In conclusion, nurse educators wear many hats. Some of the roles I consider similar, such as advisor and mentor, to help build students and faculty together. Co-learning and collegiality relate since a collaborating approach is used when working with faculty or students. And I hope you all enjoyed my presentation. Thank you.